This is Group Two's presentation on multiple sclerosis and Guillain-Barré syndrome for Adult 3 at Xavier University. First, we are going to be talking about multiple sclerosis. Risk factors for multiple sclerosis include age, as those who are 16 to 55 are much more likely to be diagnosed. Next, the females are 2 to 3 times more likely than males to be diagnosed. Those with a family history are at an increased risk, as well as those who have previously had the Epstein-Barr infection, are of Northern European descent, have low exposure to sunlight and low levels of vitamin D. And then there's also some autoimmune disorders that can predispose one to multiple sclerosis, including thyroid disease, type 1 diabetes, and inflammatory bowel disease. Finally, smoking is another modifiable risk factor that can increase the likelihood of developing and being diagnosed with multiple sclerosis.
Hi, my name is Megan Lorenz, and I will be discussing the manifestations of multiple sclerosis. According to Limont et al., the manifestations of MS vary according to the areas destroyed by demyelination in the affected body system. The systems that MS affect are respiratory, urinary, gastrointestinal, musculoskeletal, neurologic, sensory, and reproductive. According to the National Institute of Neurological Disorders and Stroke, the initial manifestations involve blurred or double vision, red-green color distortion, or even blindness in one eye. Fatigue is considered to be one of the most disabling manifestations and affects almost all patients with MS. The manifestations typically last for several days or weeks, then completely or partially resolve. The patient then will experience a relatively normal function for a period of time, and then the manifestations reappear.
As the disease progresses, multiple sclerosis has a multitude effect on the body, with increased destruction of myelin sheaths, buildup of plaque, brainstem lesions, and upper motor neuron involvement. The chances of complications associated with the disease increases, such as respiratory infection, recurring UTIs, incontinence, paralysis, DVT, convulsive seizures, dementia, depression, blindness, sexual dysfunction, and dysphagia.
My name is Tim Holt, and I will be presenting the Therapeutic Holistic Collaborative Care of Multiple Sclerosis and Guillain-Barré Syndrome. Nursing care for multiple sclerosis includes monitoring visual acuity, speech patterns, swallowing, activity tolerance, and skin integrity, as well as monitoring cognitive changes and planning interventions to promote cognitive function. It is important to facilitate effective communication for dysarthria using a communication board and exercise and stretch the involved muscles. There are a wide range of medications used for those suffering from multiple sclerosis. They include immunosuppressive agents such as azathioprine and cyclosporin that are used to reduce the frequency of relapses. Corticosteroids such as prednisone are used to reduce inflammation in acute exacerbations. Dantrolene, baclofen, and diazepam are antispasmodics that are used to treat muscle spasticity. Intrathecal baclofen can also be used for severe cases of multiple sclerosis. Interferon beta are part of the immunomodulator class that are used to prevent or treat relapses. Carbamazepine are anticonvulsants, which are used for paresthesia. Docusate sodium is one of the stool softeners that are used for constipation. There are also anticholinergics that are used for bladder dysfunction, and then beta blockers and benzodiazepines are used for tremors. Interprofessional care is important to consider referral to occupational and physical therapy for home environment assessment in order to determine safety and ease of mobility. Use adapted devices to assist with activities of daily living. Is important to refer to speech-language therapists for dysarthria and dysphagia, and emphasize the need to avoid overexertion, stress, extremes of temperatures, humidity, and people who also have infections.
Hi, my name is Eric Gass, and I'll be talking about the psychosocial impact of multiple sclerosis. As you can see, the chart on the right gives a good summary of the different effects that MS has on the individual, both psychological and social. I'll be briefly discussing just a couple. The person can have disturbed body image disorders, which affects both themselves and can alter potential relationships. Someone who is independent can become wheelchair bound. The independent person can become dependent for most basic ADLs. There's also a financial strain on the individual and family, as this disease can become chronic. Anxiety and depression are also impacted on the person and family.
Community resources for multiple sclerosis stem widely through organizations such as MSAA, otherwise known as Multiple Sclerosis Association of America, trying to improve lives today being their motto. This organization is developed via a website that contains information about MS in general, such as symptoms, treatment, and how the diagnosis is obtained, and future steps of living with the disease itself. It also displays ways to communicate to others through online chats if someone has any questions, along with displaying any physical activity such as swimming or other exercises people with MS can do. It also has emotional support systems. If somebody is feeling down, they can speak with a therapist. It brings up ways to be happy while also can answer questions about insurance and financial and legal questions as well. MSAA hosts special events for those with MS, such as golf tournaments, swimming competitions, and fashion shows. This program works hand in hand with those who have multiple sclerosis, while also supports people, making them feel that they are not alone. It provides an abundance of opportunity for those as well. Some other organizations have very similar aspects as they feature and focus on MS information, financial aid, support systems, statistics about the disease, MS therapies and other exercises, caregiving centers, and MS specialized doctors and other resource events. Through these organizations and opportunities, this is an outlet for those who have MS and want to speak with others, or can develop other friendships with those who also have similar diagnosis of MS itself.
MS affects the patient in many different ways depending on the extent and location of demyelination. Many of the effects of MS occur during a relapse, but then resolve for a period of normal functioning. MS impacts perfusion. The paralysis, poor mobility, and impaired sensations can lead to increased risk for impaired skin integrity and increased risk for DVTs, and also poor perfusion in general. Mobility is also impacted due to fatigue and limb weakness and ataxic movements, intention tremor, spasticity, and muscular atrophy. There's also foot dragging, foot drop, and impaired mobility connected to the demyelination as well. MS also impacts cognition. It leads to emotional lability and mood alterations. Euphoria and depression are common, but depression is more common than euphoria. Patients may also experience forgetfulness and apathy. They may experience scanning speech, impaired judgment, irritability, dementia, and even seizures. MS has many sensory and perceptual effects, such as blurred vision, diplopia, visual field defects, eye pain. Patients may also experience vertigo and tinnitus, nausea, numbness, paresthesias, diminished sense of temperature, pain with spasms, loss of proprioception, and blindness. Patients may also experience loss of genital sensation, which can lead to sexual dysfunction. Patients may also experience nutrition and urinary or GI effects from MS, such as difficulty chewing, dysphagia, nausea, urinary frequency and retention, reflex bladder emptying, recurring UTIs, incontinence, decreased or absent sphincter control, bowel incontinence, and constipation. Oxygenation may also be impaired due to the effects of MS, as it can diminish cough reflex, which can increase the risk of respiratory infection. They also are at increased risk of DVTs and convulsive seizures, which can impair oxygenation as well. Next, we are going to be talking about Guillain-Barré syndrome. There's not much research to determine specific risk factors for Guillain-Barré syndrome, but research as of now shows that males and young adults are much more likely to end up developing Guillain-Barré syndrome. Additionally, infections are a huge factor in developing this syndrome, specifically those with the Campylobacter bacteria. Those are going to predispose you to this, as well as the influenza virus, cytomegalovirus, Epstein-Barr virus, Zika virus, hepatitis A, B, C, and E, HIV, mycoplasma pneumonia, prior surgery, and Hodgkin's lymphoma.
Hi, my name is Megan Lorenz, and I will be discussing the manifestations of Guillain-Barré syndrome. According to Limon et al., the manifestations of Guillain-Barré syndrome vary depending on the stage of the syndrome. In the acute stage, which may last for 2 weeks, the patient may experience severe and rapid weakness, loss of muscle strength progressing to quadriplegia and respiratory failure, decreasing deep tendon reflexes, decreasing vital capacity, paresthesias, numbness, pain, and inability to change facial expressions. If the autonomic nervous system is affected, the patient may experience bradycardia, sweating, and fluctuating blood pressure. Then the stabilizing stage occurs 2 to 3 weeks after the initial onset and marks the end of changes in the patient's condition. The patient's symptoms begin to level off and their labile autonomic functions stabilize. Lastly, the recovery stage can last several months to 2 years. During this stage, the patient has an improvement in symptoms and their muscle strength and function return in descending order.
With the destruction of myelin sheaths and acute onset of motor paralysis, complications that can arise with Guillain-Barré syndrome are respiratory failure, cardiac dysrhythmias, cardiac arrest, sepsis, relapse, dysphagia, pressure ulcers, incontinence, blood clots, severe nerve pain, paralysis, and even death.
Therapeutic holistic care of Guillain-Barré syndrome. Interventions in the acute phase focus on ensuring oxygenation via ventilatory assistance and preventing complications from immobility. Rehabilitation time in order to regain muscle strength and function varies. Most patients return to full muscle function anywhere from 6 months to 2 years. There are no medications for specific treatment of Guillain-Barré syndrome. However, antibiotics can be prescribed for UTI or respiratory infections. Morphine is usually administered to control muscle pain. Anticoagulation therapy is used to prevent thromboembolic complications, which include pulmonary embolism and DVT, which are associated with prolonged bed rest. Vasopressors can be prescribed if hypotension is an issue. Surgery, tracheostomy, is performed if respiratory failure occurs. Artificial airways are used for patients who can't clear secretions or have an ineffective gag reflex. Physical and occupational therapy are crucial for recovery for patients of Guillain-Barré syndrome. They usually require prolonged rehabilitation care. This begins during the acute phase and focuses on preventing complications and limiting the effects of immobility. Severe muscle atrophy and loss of muscle tone means the patient has to relearn many basic functions and skills, including walking.
My name is Eric Gast, and I'm also doing the psychosocial impact of Guillain-Barré syndrome. As you can see on the chart on the right, because this disease is sudden and rapid, The patient can feel anxiety, despair, scared. These are all feelings that the patients can experience. Some others would be anxiety and powerlessness, as the patient is almost always admitted to the ICU and is mentally alert, but suddenly becoming mute, ventilator dependent, and immobile. Family and patients are frequently stunned by the rapid deterioration of the function and fear that the paralysis may become permanent. And as multiple sclerosis, the patients impacted can become both depressed and anxious, awaiting the result from the syndrome.
Just like multiple sclerosis, Guillain-Barré syndrome has similar organizations such as GBS/CIDF Foundation. This foundation is an international nonprofit organization that supports individuals and their families affected by Guillain-Barré's and chronic inflammatory demyelinating polyneuropathy and related conditions through a commitment of support, education, research, and advocacy. The mission is to improve the quality of life for individuals and their families by providing access to early and accurate diagnoses, appropriate treatment, and knowledgeable support. These programs also provide financial support through grants via donations. GBS/CIDP also hosts events such as running and walking events for those with the diseases. The organization holds large speaking engagements as well, all across the United States and the world. The organization can also be reached by Facebook, Twitter, Instagram, YouTube, or LinkedIn. This is a great nonprofit organization to help those with these conditions to be able to learn more about their condition, along with speaking to others who have similar diagnoses and someone that they can relate with. Not only that, they also can reach out to find specialized providers who are professionals in their type of disease to help get better answers and better access of treatments.
For GBS, the demyelination of peripheral nerve axons leads to poor conduction of nerve impulses, which affects the patient with GBS in many different ways. GBS affects perfusion due to the poor oxygenation due to paralysis of intercostal and diaphragmatic muscles, which contributes to the poor perfusion. Perfusion is also affected by the fluctuating blood pressure, cardiac dysrhythmias, bradycardia, blood clots, and the decreased perfusion can increase the risk of sepsis and pressure ulcers. Oxygenation is affected largely due to paralysis of intercostal and diaphragmatic muscles, which can eventually lead to respiratory failure. Cardiac arrest is also a complication and risk of GBS, which can also affect oxygenation as well. Patients with GBS experience sensory and perceptual changes. They experience sensory loss, paresthesias, numbness, severe pain, severe nerve pain, paralysis, and all of these together can increase the risk of pressure ulcers and infection. Mobility is also affected due to symmetric muscle weakness and largely due to ascending paralysis. This can lead to an increased risk of blood clots and pressure ulcers, and also muscle atrophy from the loss of muscle strength and muscle use. While patients are not cognitively affected from GBS, they experience some nutrition, urinary, and GI effects, such as altered, impaired chewing, swallowing, paralytic ileus, SIADH, and urinary retention and dysphagia. Overall, the functional ability can be impaired due to specifically the ascending paralysis and muscle weakness. They can experience inability to change facial expression, close their eyes. They may have altered, impaired speaking, and ascending motor paralysis.